Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullah. Welcome students to our second segment on the topic Understanding Multicultural Malaysia, Disability. Okay, last time we already covered the definition, also models and some elements of counseling intervention. Yeah. So now we are moving into a more deeper level or detail of clinical implications if you have counseling with persons with disability, and we are going to divide into 5, which is general consideration, assessment, diagnosis, case conceptualization, and also interventions. General considerations. What we must have as counselor when we are having clients who have disability, we have to be aware of our own personal belief about disability and also reactions to various disability. More likely, we are going to be engaged with providers from other disciplines. We cannot handle the client on our own. So there must be other service providers included. And we must consider our office accessibility and scheduling to accommodate the client's condition. And your tone of voice and language, use the person first language versus disability identity language. Practitioners should use the first person language unless given permission by the person with disability to use disability identity language. So okay, use the client's preferred language. And when you are in doubt, use person first language to affirm humanity. For example, person with a disability, or PWD, disabled person, person who uses a wheelchair, person with autism, person who is blind. And you must avoid language that focuses on a perceived deficit. For example, confined to a wheelchair or wheelchair bound. These are language that you need to avoid. And some people associate the term person with a disability with the medical model and prefer disabled person, which is a term which associated with the social model. Person with a disability seem to be the preferred term in the current literature, and always seek to use the client's preferred language. So how about assessment? When you are dealing with a person with disability, asking about disability, even if it's not visible, is something that you need to do lah. And then assess the presenting problem, assess also the perceived social support, not necessarily the actual support, so perceive. And then assess also the disability models to inform case conceptualization and also intervention. Okay, some of the questions that you must ask about disability. How does the person with disability identify as having a disability? What messages has he or she received from the society or family? Ask the person with disability about his or her disability. What is the nature of your disability? How does that affect you in your daily life? The failure to conform or internalize stereotype is not necessarily denial of disability status. So here you need to use your clinical judgment. So when you are making diagnosis, when you are with this person of disability, think of how might a particular model of disability inform the presenting problem. Go back to the models that we learned earlier. Higher level of anxiety following acute disability onset can look like a panic disorder. Okay, and then anger expressed towards discrimination or oppression should not be over-pathologized. Under or over-reporting symptoms of depression, do not attribute the symptom directly to a medical diagnosis or disability. And lifetime of self-advocacy can result in what appears to be grandiosity or narcissism. So be careful when you're making the diagnosis. Next, the case conceptualization. Frameworks that you can consider could be the social model of disability, disability culture and biculturalism of person with disability, the family systems theories, disability as a social construct. These are some of the frameworks that you can consider using. And then presume competence first. You presume that they are capable of doing things. And disability may or may not be part of treatment. So they could come with you with an issue which is not related to their disability. So when you are considering interventions with your client, use the existing or conventional treatment interventions, but also focus on validating their experiences of oppression, not reinforcing the stereotypes and stigma they have experienced from the society or family members. And then you should empower the person with disability by emphasizing personhood, resilience, and also abilities. Yeah, you must empower them with positive things. And then your treatment goal should center around the person with disabilities' personal values, and ideally move them through disability models to integrate disability identity. So maybe they are not accepting of their disability yet, so you must help them to get to where they need to be. And then contain disability spread effect, meaning that you must let them have this insight that their disability does not really affect their whole life, and also put intrinsic values that become more salient. Here are some of the suitable theoretical orientations when you are having a person with disability as your client. You can use narrative therapy. You can, kind of assume that the experience of grief and loss as normal part of the experience with person with disability. And narrative therapy would actually help them tell their stories. Okay. And they can have information about personal narrative, give meaning to their experiences and their life, make interpretations. Okay. Next, you can also use Adlerian, which emphasizes on the importance of belonging, and then person-centered, person-centered in terms of active listening skills. This is a must lah. And probably if person-centered would be a bit difficult for less verbal clients. I don't know, you just need to try. And then existential therapy, which relates to more transcendence and spirituality approaches. You can also use behavioral, cognitive, and also cognitive behavioral therapies. Maybe REBT also in terms of belief system, frustration and tolerance. Okay, and then another approach, you could use positive psychology, also family therapies if it's related to their family issues or caregiver. And then you can also include disability affirmative therapy. Okay, besides that, there are studies that suggest religious belief or spirituality improve life satisfaction of these people by shaping the view of a disability and by providing a belief concerning their purpose of life. And then individuals with disability also can benefit from programs or services that build their self-determination and sense of independence, and completing jobs and schools would actually enable them to gain self-efficacy and develop a sense of becoming productive citizens. So they will increase their self-esteem, if they have education, they have jobs. Okay, finally, ethics and professional practice. Language, of course, you need to remember the person-first language. Try not to over or underestimate disability in a negative or positive way. Just be neutral. Like it's okay to say things like walking or standing to a person who uses a wheelchair. It's okay to say see you later to a blind person. Don't be overly sensitive with language. And then etiquette, most person with disability will ask for assistance if they need it. So, wait for them to ask. And then shaking hand is actually less common in the disabled community. You just greet them the same way you greet everyone else. But be cautious lah. And then also skill development. The counsellor can ask if the client thinks it play a role in the presenting issue their disability. You ask them. And goal is neither to overemphasize or underemphasize the disability. It's just for you to ask, just in case. And then avoid question arising from your own curiosity. Don't over ask things that are more personal. And do not assume there are normal reaction to disability, and do not hold the person with disability with lower standards of achievement. They can be more competent than people who are able, more resilient. Just in case you feel like you are suitable or you want to know more about working with disabled people. You need to expose yourself to the person with disability and build relationship with them. You know, there are local centers that you can actually try and be part of those centers as volunteers. And then familiarize yourself with local and national laws, policies, and also movements for people with disability. And then, you know, probably get to know accessibility and assistive technologies that are suitable for them, facilities that are needed for this kind of population. If you have your own agency, ensure that you have designated parking spots, usable ramps, hallway, and offices that are friendly for them. Okay. At some circumstance, you might need a translator, a person who will help with the sign languages, probably for consent form, handout, and publications. You might consider those things for it to be more friendlier to this type of population. And then, you know, scheduling appointments, consider whether the person with disability are using public transit, public transportation, and things like that. Maybe they have sleep disorder or fatigue, and they may prefer appointment at a certain time of day. You know, you have to consider all these things, their limitation, these people's limitation. Okay, some people with disability also have temperature sensitivity. They may not be able to go out during extreme temperatures. So you need to consider online therapies lah in this case. Alright, okay. In the counselling setting, you must allow space for wheelchair or space to transfer from wheelchair to office chair. You need to ask the person what they prefer, and then maybe adjust the seating so that people who cannot sit for a long time can actually, you know, be more comfortable. Adjusting the lighting and temperature, provide fan or blanket. Maybe avoid strong smell that may consider they may consider as sensitive to those type of smells. And for a client with, you know, like cognitive impairment, maybe you need to allow them time to process. So you need to be patient. Alright. Next, counter transference and also counselor reaction. You know, fear about your own vulnerability. You know, consider your own biases, consider your own limitations when you are working with this kind of population. Maybe anxiety about offending your client, things like that lah. So these are things that need to be considered in your professional practice. Okay, so as a conclusion, of course, individuals with disability face many challenges in today's society, and people often do not know how to interact appropriately with them. So compounding the problem is the fact that, you know, disability can vary along a broad spectrum of impairment, both physical and mental, intellectual, and whatnot. And counselling is individual present unique and significant challenges, but could be interesting, could be a new experience, a wonderful experience when working with them. They are also people. They have their own special things that they can share with us. And consideration of a multitude of variables must be included in a person-centered approach to help the client reach their full potential. Always be open to them and non-judgmental. Then build rapport, and when you have the therapeutic alliance, then your counseling sessions would go on smoothly. Okay, so thank you so much for your attention. We are done with this topic. Hopefully you understand the topic. I'll see you soon. Thank you.